Hi, I'm Steve Kepp, co-founder of From Day One, a forum on corporate values. Welcome to today's webinar, in which we're exploring a pressing topic, the future of benefits in an evolving workplace. The COVID-19 pandemic is prompting companies to consider changes in their healthcare designs. That's because employees have evolving needs, of course, and they're paying more attention to the plan offerings. What are the new point solutions available, we'll be asking, including mental health care, digital resources, new tools. How can companies help employees navigate the increasing complexity of the healthcare ecosystem? And with consumer experience and trust more central than ever, how can companies better understand the impact on employees? Before we dive into this topic, we'd like to thank our partners, Quantum Health, Aaptiv, and Kintone. I'll tell you a little bit about each one. Quantum Health is a healthcare navigation and care coordination company that delivers an unparalleled consumer experience for employee members, as well as validated claim savings and high satisfaction rates for employers. The Quantum team believes no one should navigate the complex healthcare ecosystem alone. Quantum Health's proprietary real-time intercept model identifies opportunities for early intervention in an employee's healthcare journey, which drives cost efficiencies and improved engagement. Since 1999, Quantum Health's model is based on deep consumer research and the insights from working with hundreds of companies and guiding millions of consumers and their providers through the healthcare and benefits journey. Kintone, as another sponsor of ours, treat your employees to a benefit they will enjoy working in every day. Kintone is an all-in-one workplace platform that empowers your team to build and customize the applications you need to effectively manage your data and workflows for better collaboration. No coding required. Aaptiv is another of our sponsors. It empowers employers to support their employees' health and wellness goals. The audio and video-based digital health app offers 3,000 or more fitness and wellness classes, which range from cardio, strength, meditation, yoga, and more. Their corporate program includes unlimited access to its content and allows employees to connect via team challenges, leaderboards, dedicated virtual classes, and coworker accountability features. Now, a few quick logistical items. This webinar is being recorded and will be available on demand within 24 hours after the event. Look out for an email in about 24 hours with the link. That email will also have info on credit for this session from the Society of Human Resource Management. And look out for a written account of the conversation next week on our website at fromday1.co. Around 3 p.m., we'll have a Q&A session. You can submit your questions anytime using the Q&A button at the bottom of your screen. Now I'd like to introduce our moderator, the business journalist Lydia Dishman, who reports and edits for Fast Company on tech and leadership, and has written for CBS Money Watch, Fortune, and the New York Times, among others. So Lydia, finally, over to you.
Thank you, Steve, and thank you everyone for participating today. We do have a timely topic for sure, and I just want to start by, I think I'd be remiss not to point out the fact that the latest study that was just announced on Tuesday by Families USA found out that an estimated 5.4 million American workers do not have health insurance anymore because of the pandemic and job loss. So that juxtaposed with those of us who are fortunate to still have jobs are navigating a very different landscape of healthcare benefits. So without further ado, I'd like to have everyone introduce themselves and tell us a little bit about their work and their organization. Kimberly, why don't we start with you?
Sure, thank you. Good afternoon. My name is Kimberly Young, and I am the Vice President of Global Benefits for PAE. And we are a global provider that supports the U.S. government in their missions for infrastructure, operations, and technology. We're located in Falls Church, Virginia. We've been in business for more than 60 years, and we have more than 22,000 employees.
It's a very large workforce. Samantha, how about you?
Yeah, thank you. I'm Samantha Dubridge. I'm from Hewlett Packard Enterprise, and we're a high-tech employer with headquarters in San Jose, California. And I'm responsible for our global benefits programs, as well as our employee mobility programs and our HR merger and acquisition practice.
Amy?
Hi, everyone. My name is Amy Noel. I work for a company called Relx. We are a large company that many people haven't heard of. We have 33,000 employees globally, but you may have heard of some of our subdivisions like The Lancet or like LexisNexis, which are very popularly used at this particular moment in time. And I'm responsible for our global benefits at Relx.
Dave, Quantum Health.
Hi, I'm Dave Luby. I'm Senior Vice President for Client Experience for Quantum Health. Steve gave you a nice introduction to who our company is, but we are a healthcare navigation and care coordination organization. We've been in existence since 1999, and our sole mission is really to simplify what is and can be a very complex healthcare experience for our members.
Thank you. Jesse.
Hello, everyone. My name is Dr. Welsh. I'm the Senior Director for Total Rewards at Southeastern Grocers, headquartered in Jacksonville, Florida. We have 4 grocery banners: Winn-Dixie, Bi-Lo, Harvey's, and Fresco y Mas in the 7 southeastern United States. We have approximately 50,000 associates. 1/3 are part-time or full-time, and the other are part-time associates.
Thank you. And last but not least, Melissa.
Hi, my name is Melissa Fisher. I'm the Director of Compensation and Benefits for Children's Hospital Colorado. We have about 8,000 team members that are employed directly through us, and another 4,000 to 5,000 that work within our facility, including our physicians. We have a mission that's focused on patient care, education, advocacy, and research. And we are definitely focused on improving child health, not only within the state of Colorado, but within a 7-state region that we support and see patients from.
Thank you. And as Steve mentioned, we have diversity of types of workforces here, which I think is going to provide some really excellent context to a full picture of what health benefits are going to look like. I'd like to know, for starters, what you're hearing as the biggest concern employees are expressing in terms of their own health and well-being. I've heard a lot about people juggling, managing stress, whether that's frontline workers, essential workers that have to be in the mix and are potentially at risk of getting coronavirus, while others working remotely are juggling work-life balance, and as we talked earlier about childcare and working at the same time. So let's take this as sort of a round robin. And Dave, I'd like to start with you because I think that your roster of clients may be providing you with some interesting insights.
Thanks, Lydia. Yeah, we serve over 220 clients today and over 1.5 million members. So, what I would say we see, I think those areas that you mentioned are certainly at the top of the list of concerns. I think health and health issues in general are continue to be a major concern for most employers and employees. And really, it's around the complexity of dealing with those health issues today. To a large degree, we're very fortunate to have more resources available to us as a general public today than ever to deal with healthcare issues. But oftentimes, people don't know where to go to find those or how to connect into them, and really to get the most out of those resources when they are made available to them. So I find that the biggest concern that I see across our membership is their concern to access those things at the right time when they're needed.
Thank you. Kimberly, what are you seeing?
I'd say our biggest challenge is stress and anxiety. Anxiety both from working at home, being remote with the children, and also some of our frontline workers and their concern about contracting the virus. And so we've tried to deploy all of our mental health services that are available through our partnerships with our vendors. We've done lots of communications. We've had all of our managers do periodic touch bases with each and every employee to check on their mental health, make sure they're okay, and make sure that those that are working from home, that there's still that team environment remotely through weekly touch bases and weekly tag ups with the team, just to check on everyone's well-being. I would say, yeah, stress has been a number one driver for us.
Yeah, I'm not surprised to hear that. Jesse, you said you had a mix of part-time and full-time workers. Are you seeing that there's any difference between the concerns of the part-time workers versus full-time?
There generally are, but most of our associates being on the front line in our grocery stores, they're first and foremost, they want to stay safe. So we've continued to put a lot of measurements in place, and that holds true whether they're part-time or full-time.
Amy. You're still on mute. What are you seeing at Relx?
Oh, sorry, I must have been cut out for a second. So at Relx, we have, I think we're fortunate because 96% of our workforce is able to work from home. We have very few essential employees that were required to, to actually be in our offices. So it was very easy for us to pivot. And what we're really seeing is the difficulty in people being able to manage everything that they have to manage during the day and still keep their sanity and their wits about them somehow. So it's coming up with creative work schedules, ensuring that people are taking the time that is allotted to them. And then we've also looked to implement new benefits, like we have a new partnership with Headspace that we're rolling out just to give people those 3 to 5 minutes of sanity, that they might need during the day, or help being able to actually get to sleep, which is really important.
Well, speaking of sleep, definitely healthcare workers are pulling extra shifts and extra hours. So Melissa, what are you experiencing there?
So what's interesting about being with the Children's Hospital and looking at the COVID pandemic, we are largely not seeing the volume of patients related to COVID that some of our other Denver Metro partners have seen. But that's not to say our team members aren't involved or impacted. So we do have COVID cases in our facility. We also have a lab that has been running testing, including antibody testing and using the plasma to monitor patients and look for antibodies and things like that. So we've had surges in telehealth in ways that we've never provided that type of support before. And so with all of the mix and the change with us, the biggest thing that still tends to be on the minds of our team members is health worker fatigue, compassion fatigue, care fatigue, that connects directly into behavioral health, which tends to be one of the top conditions that shows up on our medical plans. And then it also leads to that other kind of component of team member injuries. And so really those three work in tandem in our environment. How do we take care of our team members, keep them healthy and safe, both physically and mentally?
And Samantha, I imagine that there's a mix of types of employees there since it's such a large workforce. Talk a little bit about what the trends are there.
Yeah, we've got over 60,000 employees across the globe. And I would say, some of the healthcare things that we're seeing are similar to what everyone else has described in terms of behavioral health issues, but also people with chronic diseases needing, that ongoing care and how do they access that effectively. So much more interest in going to mail order for prescriptions, for example, so they don't have to go to a store. Trying to access telemedicine or having virtual visits with their physician, which is much more popular now in terms of beyond just the normal telehealth, having some of that available. Virtual visits for behavioral health care being used a lot more as well. And so I think all those things have really helped support employees through this time. But the ongoing challenge that we're really seeing is the behavioral health space. And we've been doing a lot there, similar to what Amy described. We rolled out Headspace a while back. That was very well received. We've also done some things that we're calling community calls internally, where we're hosting webcasts and sessions for people that might have unique challenges similar to other employees. So we've hosted some on people with aging parents, people that are parents, people that are living alone. That's been a big challenge as well. And so we've been trying to focus on some unique populations as well.
Thank you for teeing up my next question, actually, because I want to drill down a little bit more into tools, strategies, resources, and solutions. I keep hearing telehealth, not just from you all, but in previous panels and certainly through my reporting, that there has been this increase, and not just meditation apps, but actually trying to access doctors through telehealth. So what can you tell me about what's new? What are the new offerings? Dave, can you talk a little bit about that first?
Yeah, well, I think just before the new offerings, I would say just the use of telehealth in the areas of behavioral health. We've seen a 50-fold increase in telehealth claims in the last 3 months. The largest portion of that is driven by behavioral health needs. So while I wouldn't call telehealth new, I think the way it's being applied certainly is being applied much more broadly and differently than it has been in the past. We've also seen those increases in other areas that quite frankly surprised me. So areas like physical therapy for supporting of individuals that may be dealing with issues around MSK and the needs around physical therapy to support that. So I think that benefit, while not technically new, certainly has a resurgence of utilization that will be interesting to see how that continues into the future, because I think a lot of these users may be first-time users of that type of benefit, and we'll see the convenience factor and the satisfaction rates they get out of it. As you mentioned, though, there are a lot of developing what we refer to as point solutions around all these areas. Right now, today, we integrate already with close to 900 vendors across different spaces, and some of those being new, a lot of those in the mental health space. There's organizations like Will, which is a mental health digital application that can support organizations across a variety of issues from a mental health and a wellness, mindful wellness support. So we continue to see those point solutions be developed on a regular basis, and what we really try to do is make sure that we can work with our employers to understand their culture and populations, how these are rolled out, so that we can connect the members at the right time into the right applications.
Kimberly, you were mentioning doing all those check-ins, which is clearly a new thing since everyone is working remotely. Are you implementing any other types of tools just to make sure that everyone's okay? Are you doing like surveys or anything like that?
Well, we haven't done surveys, but we've really done a lot more communication around our EAP provider services, our medical vendor provider services. They've really opened up and expanded well-being offerings, and we've tried to do really robust communication on those. And I think to everyone's point, probably we've seen our telehealth visits go up by more than 200%. We've done a lot of communication around taking advantage of that benefit as well. So it's not so much new services as much as it is really driving communication and engagement around existing benefits that are already in place that perhaps were underutilized in the old scenario that we know before we went into this pandemic.
Jesse, I'm curious how this is all working for grocery workers, both full-time and part-time. How are you communicating what's available, and how is that going?
Well, we do offer our EAP program to all of our associates, and our health plan is used by about 10,000 of our associates. What we introduced at the beginning of this year was putting a wellness champion in every one of our stores. We have 550 locations, and having that person on the ground in the midst of things has been able to get the message to our associates when they needed it the most.
And this was, you said, at the beginning of the year, so before stay-at-home orders? That was prescient, or?
Well, we introduced a wellness program for 2020 And one of the key attributes was having a person at each location to share the information. And it was fortuitous that we had that in place when all this started.
Amazing. Melissa, what things are you seeing? New tools, new outreach, old tools that are getting a resurgence?
Yeah, so I think similar to what Kimberly was saying, we've had a lot of programs in place with both our benefits and wellness programs, access to content, training sessions, online apps, things like that. What has been different for us over the past few months is we've taken our HR brand and we created a separate brand all around wellness and resiliency, and it's called Here You Matter. And so we're using that to launch additional virtual tools. We're doing online nutrition, physical activity classes specific to our team members, cooking classes. We are doing team member stories where if they've got an interesting story about how they're connecting into COVID, we're providing them with that opportunity to share that out with the rest of the organization. So a lot of it has been re-promotion and kind of centralized information messaging around all the tools that we have in place, but definitely enhancing it so that we get that voice of the team member and people feel more connected to their peers, even though we may be scattered or in temporary jobs.
Amy, do you want to chime in?
Sure. I think the one thing that I'll add, and Jesse, we did also pre-pandemic, coincidentally at the beginning of the year, also implement Wellbeing Champions, and they have been instrumental in helping us get the word out, Kimberly, like you're doing, about all of the existing programs. The one other ad that we had this year, again, this started as pre-pandemic, but we capitalized on it and promoted it a little bit more in the last few months, is a second opinion vendor. So we partnered with 2nd.MD, and because people have been putting off their surgery, it hasn't been safe to go into facilities, we've really been making sure and driving registration so that people have the opportunity, now that we can, press pause for a moment and really think about, do we want to move forward with this particular course of treatment or not? They have the opportunity to be able to move, to be able to be connected with a physician in a renowned hospital, and all of that is done virtually anyway. So it's like a great opportunity. Not only are we seeing the increase in telehealth, but also then, with these experts through 2nd.MD is all, virtual visits as well.
Samantha, you already started talking about what was new or already available. Are you using any sort of measurement metrics to get to health and well-being?
Yeah, I mean, the obvious one obviously is utilization. So we do track, not on a person-by-person basis, because we want to protect people's privacy, but we do understand the utilization patterns of our employees and their family members, because the benefits that we offer across wellness and across health, people have an opportunity obviously to enroll their family members, and so we're supporting them as well. I think some things that we've seen higher than normal utilization on are things like the EAP, the telemedicine visits, or the behavioral health televisits have been really popular. We have a approach where people can go onto a program called Wellbeats, and they can do sort of exercise virtually and take classes and things. That's seen quite a significant increase because people can't go out necessarily to gyms or to other places to exercise, and so having an ability to do that. And there's some classes for kids so people can do it as a family. We've seen a lot of higher utilization in that as well.
I started hearing murmurs about exercise equipment like Peloton starting to really surge in popularity because people can't get to the gym, but they can get that virtual gym experience. And I'm just waiting for there to be like a ton of copycats, and we'll certainly see if VR plays into that at all. If people are stuck at home for too much longer, they may be willing to wear the headset while they're sweating and exercising. I want to pause briefly here because we generally do our station identification, as it were, at the half hour. So I'd like to invite Steve to come back on.
Hi, everyone. I'd just like to remind anyone joining our webinar in midstream that we're from day one and we're exploring the future of benefits in an evolving workplace. Our sponsors are Quantum Health, Aaptiv, and Kintone. As a reminder, you can submit your questions at any time and we will answer as many as we can during the Q&A session that will come up in about a half an hour. Please send them along. Now back to you, Lydia.
Thank you so much. So I'm also thinking about this notion of collaboration because obviously we're working in ways that we've never worked before. And although people that are in charge of benefits, as many of you are, have had to be sort of cross-functional by nature, I'm just wondering if you're seeing anything different now and how your organizations are handling that collaboration between who has their hands in benefits all the time and how that gets communicated to other departments. Kimberly, do you want to start?
Yeah, I mean, I think that's a really good question. I think we're, from a benefits perspective, we're probably partnering more with our risk management partners in terms of facilities around the globe that we have and their exposure to potential risks with COVID. And also just our business units and our HR team. So I think typically we're integrated from an EAP benefits frontline perspective, but I would say the interaction is greater today, sort of based on where we are and the need to have sort of cross-functional interactions as it relates to employee safety and concern.
Thank you. Melissa, what are you seeing? Are you having to do anything different to communicate and collaborate, or is it all just sort of flowing organically?
That's a very interesting question. Working for healthcare and having the culture that we have where we're very much focused on our team members, collaboration around health and wellness for our team members has always been there. We've got a separate director outside of me that's focused on resiliency. We have quality and patient safety teams that are not just looking at the quality of care that we provide, but they look at how we can keep our team members safe with PPE restrictions when they're out and providing care. We have a network of wellness champions and wellness and resiliency champions that come together to provide support, debrief. So it's very much a part of our culture. We do debrief sessions, we have articles, we host our own internal conference on safety and resiliency. So it makes it easy in times like this when you have to respond, knowing that there's already solid partners with occupational health and quality and patient safety and other areas that you can tap into. So it's just about creating the new tools and resources, communications, as opposed to navigating those relationships.
I've heard some HR people that I've spoken to off the record lament that they feel like they're in a silo sometimes. So this is why I'm asking this question now about collaboration. Amy, what say you?
I say that, you know, the virtual world has really broken down a lot of our silos. And, you know, it's fascinating. And perhaps it's because of our geographic diversity, like just across the US, we have many different pockets and different offices, and sometimes people don't think outside their office. However, I think, you know, now that we're all virtual and have meetings just like this, people are starting to think about, okay, we actually need to involve the experts in a lot of decision making. So we've been getting pulled into, you know, like Kimberly, more meetings with our real estate teams than we ever would have in the past, right? Because they want to look at, do we do the temperature checks? Do we provide PPE? Like, you know, what level, how do we return to the office? What do we need to do for our employees as we do so? So, you know, involved in all of those types of conversations, as well as our, you know, in the very beginning, our business continuity team as well, just trying to make sure that everyone was, you know, safe and healthy, and, you know, and how do we maintain everyone's ability to continue to, you know, perform their job. So lots of things have now been looked at from a benefits lens that, you know, I would say last year wasn't even a consideration.
Jesse, you said 550 locations, is that right?
Yes.
So that's a lot of, you know, fingers you need to have to communicate with everyone. How is the collaboration working at Southeastern?
Well, in the past, our associates would call into our contact center as their primary mechanism to get information. We've updated a portal for everybody to access this year. And then if they wanted to talk to somebody face-to-face, it was generally an HR business partner out in the field, but they support approximately 30 stores each. So it could be, few and far between when somebody actually had a chance to talk. So having the on-site champions has made a huge difference in being able to communicate information. And I was going to mention our telemedicine real quickly, because this was our third year where we've had telemedicine. The first 2 years, our registration of 10,000 people was around 10%. We incentivized and had some contests and things like that at the beginning of the year during open enrollment. And before COVID, we were on track to 30, 40%. And just this last week, we have over 50% of our associates registered with the telemedicine. And then, of course, it's even more important now because that's a primary resource for people. But getting people registered then makes it easier for them to actually use the benefit.
For sure. You need to be on it in order to get something out of it. Dave, don't worry, I'm going to get to you, but I want to get to Samantha first. Tell me what you're seeing.
I mean, I think I'm seeing a lot of what others have described in terms of more in-depth collaboration with the risk management team, environmental health and safety, and then real estate in particular, because we've had a long history of partnering with our real estate organization in terms of what we want the environment to be like when people are on our campuses. And now we've been working through what do we want it to be like when people are working from home, with the understanding that, we likely will have a lot of people working from home for longer periods of time than I think any of us initially had planned on or thought about. And so we've been working through that, trying to help people understand how to access the different resources and tools that are available. And then we've added some things as well to that. The other piece that I think is a little bit interesting, and again, if you're at a large employer, I think this is one of the key pieces, is in addition to educating all of our team members, one of the things that we've been really focused on is making sure that our own HR organization, our real estate organization, environmental health and safety, and others are really up to speed and have that expertise that they need to enable to support people as they come forward. So we've done a lot of additional trainings. We do weekly sessions with our HR team around what's happening with the COVID situation in particular. What do people need? Sometimes we'll get questions from various locations about the need for a COVID test, and would that be covered under the medical plan? How would they access it? And so there's a lot of different things like that we're getting questions on from the field as well. And so we're trying to more proactively have some of those engagements with people.
Well, I'm glad you mentioned trainings and education, because I think that, before the pandemic, if you had health benefits, you use them, sparingly, hopefully, if you're in relatively good health. But navigating benefits when there is this much uncertainty, I think, adds another layer of uncertainty. So, Dave, I wanted to talk to you specifically about complexity and how it's possible to educate people about, what is available to them, what they can use, what they should use, and just sort of unpack that complexity.
Yeah, it definitely is not an easy solution, but it's actually something we specialize in. So, having support systems in place that can bring the education at the right time. I see oftentimes open enrollment is a good opportunity to share information as far as the offerings that our organization supplies its employees. But, most times in those situations, it isn't at the time of need for the individual. So what we're able to do is, take the opportunity to use what might be small situations, somebody calling in about an ID card, to make sure that we're educating the employee on the resources that are available to them, by making sure that we engage in a conversation with them on what their needs might be beyond just maybe the initial ask. So I think making sure that you have a way to to navigate employees to the services that you make available to them at the time of need is generally when you're going to find the best engagement across your population.
My next question sort of comes out of this idea of complexity and being proactive. Privacy and trust are obviously tantamount, especially right now. And so I'm thinking about employers working to be proactive and working to offer additional resources, but you still have to navigate that privacy and trust piece. And so what is the role of the organization to step in and say, you know, I think you may need some XYZ help in these areas? Melissa, can you speak to that first?
Yeah, so this has always been one of our challenges in healthcare. Over the past 10 years, we've more than tripled in size. So we went from very small, kind of one centrally located healthcare system to something that's spread across 18 different locations. Yet some of those cultural practices of wanting to step in and help individual team members are still there. So we've had to kind of push the brakes a little bit and get our team leaders more comfortable with infrastructure and process to protect team member privacy and safety. So while we do have referrals from our HR business partners into resources like EAP, we actually created a brand new emergency relief program where team members can tap into funds to cover those basic needs if they're struggling right now. And that process is flowing through HR where a committee is reviewing everything, but we strip all of the identifier information off of that so that whoever's making the decision about who gets what funding has no idea the team member name, what role they're in, things like that. So we're doing things internally to try to gatekeep and protect privacy from our team members. We're also looking at pursuing other external community partners where our role is to communicate, educate about the programs and resources that are available, and then encourage our team members to tap into community providers that can get into more of the details about their life and give that level of privacy to them as they're taking care of those personal issues. So it's that constant struggle of wanting to help and be there to support our team members, but doing so in a very respectful way where we can honor their dignity.
Jesse, it seems like the new role that was implemented for 2020 is tailor-made for this type of work to navigate that. What have you seen in terms of how these people are navigating those privacy and trust boundaries?
Well, we actually hired a wellness specialist specifically to guide this program. And so she meets pretty regularly with, via Zoom and other mechanisms with this large group of people that we have in the stores to help train them and prepare them and also provide, kind of two-way feedback as issues come up. Again, we do offer our EAP program, and that continues to be a strong resource. And it's always been our associates really just don't understand what they have to begin with. So it's been a lot about educating and making sure that they know that they have access to EAP and the other resources. And the champions help bring that home. And we've actually taken a step back, and I've been doing this long enough where I remember where we used to print books and mail them to people, and we don't do that anymore, but we have gone back and we actually do print guides for each of our store locations, so if they're in the break room, they can sit there and kind of thumb through and educate themselves on what we do have available.
That's helpful in an analog way. Sometimes it's good to get yourself away from a screen and hold something in your hands that's not metal. Kimberly, what about the navigation of privacy and trust there?
Again, for us, it just boils down to communication. We just have heavily communicated that it's confidential, it's through a vendor partner, we don't have access to individual data, and we encourage them to utilize the services. It's communicate, communicate, communicate. And we've cascaded that message from leadership down to our HR frontline personnel so they can share the messages with the employees and with the managers. And from that, I think we've we've garnered some trust.
You're doing the heavy lifting for me, all of you. This is terrific. I'm so glad you mentioned leadership because on a slightly different note, similar question for Amy, what is the role of leadership in this, as it's cascading down? Because I think wellness really does have to be modeled at the highest levels of an organization. And that, I think, can engender trust in a certain way. What do you say about that?
Absolutely. I agree with that. I think I had this conversation while I was on my new under-desk walking treadmill, while our head of HR was on her new under-desk walking treadmill. So it really does come from the top down. But our leaders have been, and we have 4 distinct business units, so we have multiple CEOs. And so it is a little bit of I don't even want to say a challenge, but it just requires a little bit of extra effort to make sure that we have coordination across the business units. So we do need to make sure if we're looking to champion, headspace or virtual fitness classes or, well-being, or any other kind of message about don't worry, you are being taken care of. We have to do that conversation times 4. So we have to think about that. But our leaders have been so open. They've been meeting with our employees on a much more frequent basis than they ever have in the past. So there's so many more opportunities for us to try and, sneak in little benefits messages that they can then help us to promote and cascade.
Samantha, does that sound about right at HP?
Yeah, I think just having leaders that are willing to share some of their own experiences, in some ways almost give people permission to take the time for themselves, I think is really important. And we're fortunate that we have a lot of, not just our CEO, but our head of HR, our head of finance, like all of our business unit leaders as well, are really focused on the topic. They share a lot about what they're doing. They want to make sure their employees understand what resources are available. And then, certainly when I come forward with requests for, financial resources, they've been very supportive for things like Headspace and other new things that we've added over the last couple of months.
Dave, do you, outside of the obvious HIPAA regulations for privacy, is there something that Quantum Health offers to help your clients navigate the privacy and trust issues?
Yeah, I think we have a mantra that we share with our clients, which is call quantum, right? So, the challenges that you take on as an employer to deal with those situations and still navigate the privacy issues can be challenging, where, we as the third-party vendor, you can send your, employee to us for their questions or their needs, and we can direct them. We're more than just a health benefits support. We try to really understand the full gamut of the benefit offerings you have as an organization so that we can be there to support the member in whole. So, we can be a big resource in taking a lot of that burden off the employer's plate. When we talk to our employers, they estimate that about 40% of the workload that typically falls to HR, as much as 40%, can be reduced by having that work supported by our teams.
One of the questions that's popped up in previous conversations with different groups about benefits and certainly about employee well-being and engagement is everybody seems to want to know what metrics you use to measure health and wellness, what metrics you use to measure what benefits are needed. So I'd like to sort of do a little round robin on this question and have everybody just talk a little bit about what they're using as for lack of a better word, KPIs for, deciding, what you're going to implement, what you might take away, what the needs are. Melissa, do you want to start?
Yeah, absolutely. We have a fairly robust data set that we work with in analyzing benefits and wellness trends. So within our wellness program, we've got engagement, participation rates. We have feedback directly from team members in an aggregate around health risk assessments, mental health, biometric screenings. So all of that is in our wellness platform outside of the traditional claims utilization data that we get from our medical plans. And then within other resources, we've got EAP utilization and tracking what are the top conditions, the trends that we see there. Within the organization, we have access to workers' comp injuries and claims, direct feedback from our team members. So we do quarterly engagement pulse surveys where coincidentally today we launched our pulse survey, and kind of the focus area questions are all about wellness resiliency. And so we're going to have a pretty awesome data set within the next couple of weeks about how our current team members are feeling. So our top KPIs are always utilization. Are we seeing year-over-year improvements with claims, with costs, and then engagement and participation in our programs and direct team member feedback.
Jesse?
I mentioned that this was kind of year one for our wellness program, so we're 7 months into it. We do a lot of competitions to incentivize, and so we share a lot of aggregate information. We actually have a points requirement for each quarter of the year for our wellness program. And interestingly enough, it's been some of our senior leaders that have had some of the highest points, and we've been able to advertise that, and that helps to set a good tone for everything else that we're doing. Registration in our program, we actually have 99.5% of our associates in the health plan that have registered for the program. So we just couldn't get that last 0.5%. But we've been really doing a lot of competitive things, all sharing aggregate information to kind of leverage and incentivize people.
Yeah, the whole game theory thing, I think there's a lot to recommend it. People love to see themselves on the leaderboard, and it kind of fosters that friendly elbowing of, hey, I'm doing this, or someone else is doing that. Kimberly, what say you?
Well, we're really at the beginning stages, I would say, of our wellness journey. And I'd say before we enter into it fully, we started with a redesign of our basic benefits, implementing more disease management programs to monitor and manage some of the high cost conditions we see in the population. But one of the things I've done since we're in this new pandemic is rolled out a wellness challenge for these last 6 months through a third-party vendor, just since everyone is mostly virtual, to drive participation and engagement. And it was usually successful. And that was an initiative that I'm moving forward for 2021. But the way that we define and make recommendations for programs is, just as Melissa mentioned, through metrics, through utilization, engagement, outcomes, and costs, to measure what we need, what are the target areas we need to focus on, and how can we sort of create more utilization and participation and engagement in our existing programs. I've also just recently hired a wellness coordinator that will kind of lead and integrate programs as we move forward. And then in 2021, I hope to onboard a wellness vendor where we'll have a platform dedicated to all of our wellness initiatives. But this initial pilot rollout was of a virtual walking challenge where there were teams and leaderboards, and it was hugely successful. People are really energized by it. My own team, everyone got t-shirts and sends pictures of how they're doing, and leadership is competing against each other. So it's very successful, but wellness takes a lot of time and dedication, and you do need resources and wellness champions and leadership buy-in in order to keep it going, as well as your other benefits job, right?
Yeah, it sounds like a lot of you are doing the work of 3 or more people during this time. I've also heard that some people that are heading up benefits are finding themselves in the role of counselor to employees that are coming to them one-on-one. But that's another topic. Samantha, what metrics are being used in your organization?
Yeah, we have sort of a mix. So we have things that we collect from employees around health risk questionnaire data that they share year over year, satisfaction surveys. We look at utilization patterns, sort of how people are using the health plan. or how they're using some of the wellness resources. So for example, we have a walking challenge like Kim was mentioning, and we do that every year. And we started to get really refined in what we were measuring. So we went from how many people registered, and then we got to how many people registered and how many people actually tracked information every single week and were really sticking through it every week. And we saw which weeks people were dropping off. And so it allowed us to make some adjustments there. But I think over time, we've sort of refined our strategy of what we're looking at. And then the only other piece I would just say is that we also, in addition to wanting to see high participation, we also understand that we have very targeted programs that in some cases won't have very high participation. It's fine. They're programs that are for very niche needs that we think are important. Like we have a vendor that helps us with supporting parents with special needs children. And we wouldn't expect that that would be a broadly leveraged service, but it's an important service. And so it's still included as part of the package.
That last one to me is getting cut for some reason, so the delay or something. Yes, I would agree. Our metrics, we look at things on a geographic basis, so we collect a lot of metrics, and then we start to look to see, to make sure that participation and, you know, other KPIs are following where we have a majority of our, or that it's consistent with how many employees we have in each location. And then that allows us to be informed by the data. If we see, you know, super high participation where we might have a small employee pocket, right, we're able to then look to see if we can leverage our well-being champions to get the word out about something and drive engagement elsewhere. But similar to Samantha, we want to make sure that we are meeting our employees where they're at. So we know that there will never ever be 100% adoption of every single benefit. We want to make sure that the benefits follow people as they go through their life and career cycles. And so we want to make sure that people know what's available when they need it. And that is a huge challenge, but something that we're working on through our communication efforts is really segmenting our population and trying to target so that they know about the benefits, you know, ideally at the moment that they actually are required.
I'm liking the idea of this job title of wellness champion. I'm going to have to file that away in my favorite job titles folder. Dave, I would guess that there's some sort of dashboard that you offer your clients. So do you want to talk a little bit about that?
Sure. I would just, I would say everybody has mentioned what I've seen across employer groups as far as different ways of tracking and measuring. We supplement any other tracking and measurement opportunity that our customer has with a complete data analytics that allows for those KPIs for us to look at those, figure out strategies and things we want to work on for the future, and then look back to see what impact, you know, our strategies and programs have had on those. You know, areas of focus over the last few years, in addition to the wellness activities, have been on, you know, your disease drivers around diabetes, heart disease and others. And really what we try to do there is really track, you know, the ability to close care gaps. You know, oftentimes these disease states when managed, you know, can be lower cost in a managed state versus in an unmanaged state. And so our ability to try to really engage with the individuals to make sure that we're closing care gaps there is important for them. So we see care gaps as a big KPI that people look toward, in addition to some of the others that have mentioned around claims trends. And another big one that's been measured more recently is primary care utilization. We've started to track through different cohorts in our data analytics for our customers on what is the overall cost of high cost claimants that have, you know, primary care attributed relationships versus those that don't. We see a significant difference in the overall cost of individuals that have those relationships versus those who don't. So sharing those type of insights and KPIs so that we can figure out what the right strategies to work on for the future for our customers is what we try and do.
Great. So we're almost at the top of the hour when we do the fun thing of taking questions from the audience. So I'm going to invite Steve to come back for just a moment, and then we can dive into those questions.
Thank you, everyone, for participating in the future of benefits and to our sponsors, Quantum Health, Aaptiv, and Kintone. At this point, we'd like to hear questions from the audience. Lydia will choose among them and pose them to our panelists. Thanks a lot.
We already have a few of them coming in. I wanted to start with a question from Isabel about the EAP programs. Are they standalone? Is that paid for by the company, or is it a free program baked into the life and disability carrier? So I think any of you can answer that one. Who would like to raise their hand?
I think we're all open for going. At Hewlett Packard Enterprise, it's a separate program. It's free to all of our employees and their families. And they can also leverage behavioral health through the medical plan.
Different somewhere else? Amy, you were looking like you were going to answer.
Same exact thing, standalone program, and then, you know, other services are provided through the medical carriers.
Question from Ashley was asking about, specifically to Kimberly, but I think any of you can answer this really, the EAP, tracking the EAP utilization through the vendor or through another type of tracking?
Through the vendor, through their utilization reports.
Others have the same experience? Yes? Okay. Another one from an HR director who did not want to be named, but says, I've been checking in one-on-one with staff. I find that many are hesitant to share how they're really feeling or managing and talking about their struggles, stress levels. For manager check-ins with employees regarding wellness, anxiety levels, and stress, what are some good questions that managers can ask employees to get them to talk about these things? And I would like all of your insight on this, because I think that this is a really important question. So we can take this one as a round robin too. Who would like to start?
So for me, it's the question of how are you? And then usually you get the, oh, you know, fine, doing well, or blah, blah, blah. And then it's like, no, how are you really? And adding the really at the end actually makes a difference, because people start to, you know, be in communication. And it's also about asking the question and stepping back and listening more so than saying anything else. And I find that employees are then have the space to be able to be in communication if they know that I'm going to be listening.
Someone else? There was a few hands raised. I'd like you all to give your insight on this. So get ready.
So I can jump in. I would agree with Amy. It's all about the relationship that you have with a team member, and just asking those basic questions and making sure that you've got the space to hear their answers. What we've also looked at doing within our organization, and we got the content through one of our medical providers, actually, it's a mental health first aid training that gets rolled out to all of our team leaders so that they can recognize the signs that somebody is struggling, and give team leaders additional tips and techniques for how to step in and help support those team members. So if you're looking for additional support, I would encourage you to talk to your medical providers and see if they have content that they can deliver.
Yeah, I would say we do similar that everyone else mentioned, but one thing we did a little different is not only do you check on your team to see how they're doing, but we skipped a level so that my boss actually checked in on all my team members and called them and asked them how they were doing and given them feedback so that they could share honest feedback with her as well. And that was very positively received in terms of someone other than myself checking in on them to see how they're doing. So skipping a level was very helpful. And then we had internal check-ins just with other leadership as well. And I think the feedback was fairly honest. It was really positively received. And we do have mental health training as well, first aid through our EAP provider for our HR personnel that's available.
I would just add, I think in addition to, the things that have been suggested in the moment, I think it's important too that you continue to strive to build a culture that allows for, kind of that ease of conversation, that give it that safety to that person to be willing to have that conversation when the time comes. One of the pillars that we talk about within our organization is sanctuary. And it's what our PSRs try to drive with members when they call into us, is a safe space to really have that conversation and open up. And generally, that has to happen through more than one interaction or one conversation, but continuing to drive a culture of openness certainly will help with that.
Now, we've done a few similar things to what other people have suggested in terms of training managers, having open dialogues, but we've also done some things, I think, that sort of take some of the pressure off of that individual conversation and feeling like maybe somebody doesn't want to disclose, or even maybe a manager isn't super comfortable knowing exactly what to do if someone discloses more than what they're really capable of dealing with. And so we encourage people to try and have those check-in moments, but also to monitor for different behaviors that they might see. Have some dialogues that are more team focused about how are we doing as a team. Sometimes once one person shares, if you've got somebody that tends to be a little more vocal, that can open up other people on the team as well. So just trying a couple of different methods to get people to feel comfortable. The reality is, though, you're going to have some people that just aren't comfortable talking to their manager, and that's okay too. And that's why we really try and push some of these other resources so that they understand that there's lots of different ways to get support. I mean, we obviously want to support them, but they could go to the EAP if they wanted, or they could go to a coworker. And we've had, a lot of discussion about behavioral health for the last 2 years in particular. And so we've done a lot of training with all of our employees around how they can support each other.
Jesse, you want to chime in?
I may have missed part of the question. It's almost like clockwork. At 2 o'clock, the internet resets. But having meetings with the team on a regular basis is something that we do. And we've actually, since a lot of people are at home, we've taken the opportunity to have associates share their families with the group, because that's not something we would necessarily normally do. And it kind of brings us all into, we're all in this experience together, and kind of spreading that and getting to know not just the associate, but their families has been very helpful.
Carrie had a question about communication also, and she said that the organization is similar to Jesse's. We have grocery stores and wholesale warehouse distribution across multiple states. We struggle with communication to a majority of our population who have no virtual option and do not have wellness champions at each location. What suggestions do you have for effective communications? And there's another related question from someone else, but do you want to take a stab at that, Jesse?
Sure. So we use an online system for training, and we've leveraged that for communication. So we have the majority of our associates don't have access to email, but they do log in every day and get bite-sized training as well as messages from us. I think the game changer has been having that person on site to be able to give relatable firsthand information, and it's someone that they trust because they already know them. I think that's been huge. But it's just getting them the information when they ask and making sure that it's accurate.
Stephanie's question is related. She thanks everyone for their insight and said, everyone spoke of how important it is to communicate. What have you found is the most effective way to communicate to employees? Is it mainly email or videos posted to an internal portal or something else? I know that some employers use Workplace by Facebook, and that you can access on your phone. I don't know if any of your organizations use that, but is there any other suggestion from any of you about communicating? How do you do it?
So at the hospital, we do have barriers in that the majority of our team members don't sit in front of a computer all day long. but they have access to mobile devices and other communication mechanisms. So we do content posted to our internal SharePoint pages. We do emails when necessary, although we know our readership levels are low. Typically, the people that most click on and read emails are our team leaders. We've encouraged our team leaders to do daily huddles, where if there are updates that they hear about benefits, wellness, or other HR matters, the leaders are then asked to share the information at the huddles. Good old-fashioned flyers in break rooms, on huddle boards, in the bathrooms. And if we have to, we'll mail stuff home if we need to connect into team members and we feel it's important enough to use the traditional routes. So everything, we do every option we potentially can. With COVID, we've actually been in a really good pattern where they've dropped down to weekly, but we had daily team leader calls where if things were changing, we could get instant information about what was changing and how to respond.
The company, we do the same thing Melissa outlined. We have multiple modalities of communication that go out with, some are digital, some are print, some are communication across teams directly from managers or teammates. It's generally that multiple modality kind of effort that I see work most effectively across most organizations, especially large organizations, because you have multiple populations who may or may not have access or more readily available access to certain technologies. So generally having multiple ways of communicating tends to work out well.
Does anyone have anything else to add?
I'll reiterate the same thing. I'll quote Kimberly: communicate, communicate, communicate. Just saying things multiple times. And because of Zoom and the pandemic, people becoming more familiar with this kind of tool, we fully intend on leveraging this during open enrollment season coming up.
Speaking of tools, Scott has a question about increased utilization of virtual tools by employees from home, telemedicine, Wellbeats, etc. More likely using company-sponsored equipment. Have there been any concerns raised by corporate IT departments regarding network traffic, security, etc.? This might be a little niche of a question to answer, but I think it does play with that privacy issue as well. So does anyone have any experience with this?
This is Amy. I can just say that, we are a large data company, and so we take data privacy very seriously. And we've had this conversation, with our top security experts, and, they fully recognize that people will be, doing more on their work computers while they are at home. And it's just up to us to make sure that our, data security is up to snuff. And then also we do frequent like phishing activities. They're very tricky because one time our team sent an email and it says about your benefits, and I'm like, I didn't authorize this. Click, oh, they got me. I had to go to training, right? So it's like they really are trying to target and make sure that we are super hyper aware of, what it is that we're doing, what it is that we're clicking on. And but we know that as an organization, that's our responsibility, because people will start to blur those lines between professional and personal.
Yeah, I think given what HPE does, sort of similar to Amy, we have a pretty robust process for data security in-house, and obviously we do that for our customers too. But each time that we're selecting a vendor, we go through a vetting process. Cybersecurity is actually involved in any vendor selections that we make to ensure that we've got the right protections in place. And then we have had to expand out the offerings that we had. So I would say in the past, the majority of like our communications when we're doing internal meetings would have been on one platform. And now I feel like every week it's, Skype, Zoom, Blue Jeans. I mean, it's like all these different components. And so as we're starting to talk to our employees about how do they leverage some of those, we certainly have the ones that we're using, but more and more we're using ones that our customers or our vendors are using as well. And so just having people cognizant of what types of phone conversations or meetings like this that they can have across different platforms. So some education for our folks, and even some education about how to leverage the bandwidth that's available. So thinking about when they're doing certain components. So for example, if they're hosting a really large meeting and having every single person be on camera like our panelists are today, takes a lot more than just having a subset like the panel on display. And so trying to help people think through some of those things to try and avoid some issues and some common pitfalls has been what we've been focused on.
I'd like to move on to the next one from Christy, and she's asking about how you handle promoting benefits programs and engagement activities when business leaders may be resistant to take people away from business due to productivity. So always that fine balance between engagement and productivity. Who would like to take this one on?
I can speak for just a second, Lydia. During open enrollment last year, before we introduced the wellness program, we went through a lot of detail showing the cost of our health plan and how it continues to go up. And we have to do something as a company to control those costs, and trying to get an understanding and buy-in from everybody that it's not just okay to go to the ER when you have a hangnail. You've got to think through these things and make consumer-driven choices. And we're all in this together. So I guess going back to kind of the contest aspect and getting people interested in understanding what's in it for them. And hopefully it will lead to lower cost increases or maybe flat increases in the future if we do a good job controlling costs in the given year.
I think the other piece that's important there, in addition to the healthcare cost, is just if you think about how a person typically needs to spend their day, if they actually have a healthcare need and they haven't been given the resources and they don't understand where to go for support, they can spend an enormous amount of time trying to track things down. And so part of what we frame is that we want to make sure that people can most efficiently and effectively get what they need. And part of that is making sure that they understand where those resources are. So we actually have a hub site where all the benefits, all of the total rewards are available to our employees. So that's one mechanism that we use, and that's a place where we consistently drive people. But it is an important piece of communicating with people, not necessarily to maybe the negative side of it is we're pulling them away from work, but the other piece of it is when they actually need something, it's saving them a lot of time.
Yeah, I would just add that we have a lot of unions in our population as well. And one of the things we do is videos, and we post that on our intranet site. So a lot of the material, you don't have to leave your work site and interrupt production to listen and learn. You can do it after hours or anytime and just tap on an education video. It'll take you through how the program works and where all the resources are.
Somewhat related question from another attendee about investment in people. Where does employee wellness stand in terms of being a priority today versus before the pandemic? And I know that some of you outlined these new roles that you have, wellness champions or whatever. But what would you say just off the cuff and as the priority for wellness now? Is it different? Dave, do you want to start?
Yeah, sure. I don't know that it has changed much. I mean, certainly the focus of the last, 3 or 4 months has been different. But I think as far as addressing, productivity and healthcare costs for organizations, I think if you don't focus on wellness, you're missing a big piece of the pie. And I think most employers over the last, 10 or 15 years have really understood that. And much like you've heard from the panel today, have either started to or have already implemented a lot of wellness activities. I think what I've seen too is that that definition of wellness and well-being has expanded beyond the traditional wellness consideration. So, we've talked about wellness programs as it relates to physical health, but there's more programs than ever being offered around mental health, around financial health. So if anything, I see it kind of expanding out from its original definition or its original thought for most employer groups.
Anna is asking about wellness and COVID recovery. Is anyone providing additional PTO for those who may be quarantining at home and unable to work remotely? Anyone can take this one. I'm curious to hear if you all have insight about this. Additional PTO?
We do offer it, but it's sort of ad hoc, as requested, as needed. There's no real formal program in place, but it is offered if you need it.
So in the state of Colorado, there was actually a legislation passed that requires employers in certain industries to provide additional emergency sick leave in response to COVID. And while ironically, healthcare was not one of the industries that was named in the legislation, we adopted to follow that legislation. So we do have additional PTO available to team members, specifically those that were impacted, exposed at work, although that's hard to prove, but exposed at work, exposed through a coworker, through a patient, and also protections, including some of our team members that are traveling remotely to provide support in other states and other healthcare organizations.
This is Amy. I would add we're following, local jurisdictions as well in general. However, at the beginning of this year, we did a big push. We completely modernized our parental leave, and included with that, we introduced something called modern family leave. And so we do allow for up to 8 weeks of paid time off that would be falling under the definition of FMLA, so caring for, a sick family member. So some people have been able to take advantage of that paid time through our, basically through our disability program, under FMLA, to be able to have time to care for others who may have fallen sick within their family. But we're not offering additional PTO kind of on a just because basis. We're encouraging people to use the time. We have a generous policy already, so we want people to use the time they already have.
We haven't added additional PTO days, but we do offer some additional options for people in terms of, sort of other time off. We're just not putting it into like a PTO bucket and using it that way. But we do talk to people about, if they have childcare needs or other support that they need to provide to people and it's causing disruption for work, then they need the extra time that they've got some flexibility there to do that.
And we've coordinated our efforts with our different states and the unemployment benefits that are available. And if there's a gap in the coverage, because we do have a lot of part-time workers, like I mentioned before, some are very young and some are very old. And so, part of that group is at a high risk. And so we do offer some extra time off to cover if it doesn't quite fit the unemployment parameters.
Offered additional PTO time off or PTO days under a set criteria list. So there's a few things that have to be checked off before that'll be granted, but we do offer it if you meet those criteria.
Well, speaking of additional benefits, 2 of our attendees have a similar question about childcare benefits. Lauren and Brad are both asking what policies, arrangements, and resources are your organizations considering to assist employees as a result of many school districts continuing distance learning? And Lauren is saying childcare is open, but it's unreliable. What are other companies doing to help support parents that have to split time on their job and enable distance learning?
This is Amy. We've been working with Bright Horizons, and that they provide backup care. So it's not meant to be a regular daycare, though, if there's an important meeting coming up, employees have a certain number of days throughout the year that they can use the backup care. They are also starting to provide more virtual options and like a virtual nanny, which is very interesting to me. It's outside of the backup program, but employees could take advantage of it. They would pay for it directly, but they could have an hour or two where if they want to, you know, just sit and eat dinner by themselves, plop the kids in front of the computer, and the nanny will do some activities with them, you know, for a set period of time. So there's some interesting programs that we are starting to promote. They're doing some virtual summer camps as well, so employees can take advantage of some of those more unusual opportunities if their regular go-to options are not open this summer.
Anyone else doing anything creative for parents?
So like Amy, we utilize Bright Horizons for backup care. So that's a separate program service that we have available that we've had prior to COVID. I mean, being healthcare workers, if you have to come in and fill a shift, you need someone that can be at home with your child. We've also done, we did it during the initial stay-at-home order, so we'll see if it comes back in the fall, but we did allow team members, if they just needed time away from the job to focus on family and kids, we created a separate COVID personal leave option where it provides that job protection, where they have the ability to use paid, unpaid leave to cover any amount of time that they wanted kind of away from work to focus on family. So that may come back within the fall, depending on what local school systems do. And then we also opened up and made our telecommuting policy a little bit more flexible to allow people grace. So if you're at home, working from home and monitoring school plus trying to get work done, that we gave people a little bit of grace and being able to manage that, and actually amended the policy to make it very clear to team members that we understand we're in unprecedented times. If you need that ability to manage both, we're going to give you that grace.
Yeah, I think that piece is really important. We've really tried to articulate that we'll be flexible with people for what they need. We've also got a backup childcare arrangement that we have. And they also do some things around helping like with tutoring and things like that. So even if you have maybe an older child who doesn't need daycare per se, but maybe they need homework support, you know, we've got some resources like that that are available to people. We've done some tip sheets, and like I said, we've done some community calls where employees have come up with some really neat suggestions about different things that they do within their own home to sort of organize, help set expectations with their kids, and that type of thing. And that's been, I think, useful for people as well.
I think we have a little bit more time here. Wallace is asking, we're needing to adjust our new hire benefit education because we're hiring employees on an almost daily basis. Good for you. That's great to hear. Versus Monday starts. And also they got requests to minimize the time employees are at a new hire orientation. Any suggestions? How do you handle new employee orientation?
We have virtual options for new, you know, obviously in this new environment, it's virtually. Prior to that, it was in person, but we also had a virtual option as well.
We do too, and then we have sort of a mix of things that people can attend live and participate, and then things that are just sort of on-demand self-service types of things to help people through. But we've always, I guess just the nature of our business, we've always had some number of employees that are joining us virtually. Maybe they're going to the sales organization or things like that. So we've, you know, been lucky that we've been able to leverage some of those resources. And then we also have guidelines around what we expect managers to do to help onboard people, and have spent a little bit more time with our IT group and things like that on how do you get them the right equipment, how do you make sure that they're set up and ready to go really quickly when they're doing virtual. But you know, those are some things that when people are on site, it's much easier because you can just hand them their laptop and, you know, set things up for them as you're just dealing with them face to face. And so virtual, we've had to think through a little bit more about how to really effectively do that for folks.
We have a children's, what I would call really high touch process for new employee orientation. especially related to benefits. We have embedded with us dedicated benefit communication specialists, and one of their focus is to meet with all new employees sometime within the first 2 weeks to do one-on-one benefit information sessions. The sessions for new employees typically last about 30 to 40 minutes, but they'll really walk through everything that we offer, answer whatever questions the new employee has around benefits, and make sure that they have the information and resources needed for orientation. And so we had that service now for 2 years. And when we hit the pandemic, that team just shifted to virtual sessions.
I want to take time to just address one more question here before we wrap. One of our attendees observed that your organizations are all very large and they say that their organization is small and those types of tools and resources and benefits aren't available. Dave, do you have any suggestions for a small organization?
Sorry, I was just trying to get off mute. Yeah, I think there are options that you can pursue. There are association groups that, whether it be your local chamber of commerce's, I don't know how small of a group we're talking about here, but in my past experience and groups I've worked with all sizes down to 2 employee lives all the way up through national employer groups. At the smaller end, they've taken advantage of larger purchasing group opportunities, whether it be association businesses or chambers of commerce. You can sometimes access benefits that you wouldn't normally be able to access at the smaller employer sides. So that might be an area to investigate.
Great, thank you. And I'm sorry, one more, really. COVID safety is a high priority at our company, but we still have some of our associates who've refused to wear PPE. How would you address this as other associates are starting to raise concerns? And I think, we're all going to be dealing with this in one form or another if we do start going back to the offices, those of us who are working remotely. So can somebody chime in on this one?
I think it's a matter of.
Go ahead, Jesse.
I apologize. If you respect others, you're going to do what helps to make them feel comfortable. And shame on you if you're not willing to do that.
I know we've made it mandatory. We've been an essential business and open from day one with various number of employees on site at any given time. We've made it mandatory from a mask situation from very early on. There are exceptions that are allowed for that for certain health reasons, certainly. And if you express that that's the case, then there's flexibility there. But and then we've just partnered that with the other accommodations from a social distancing perspective relative to workspace and things like that across the office. But we've made it mandatory from a mask perspective.
Thank you. So there were more questions, but we're running out of time, so I need to kick it back to Steve. But I did want to say to the attendees who are asking very specific questions, try to reach out to us on LinkedIn. I think that would be a great place for everyone to connect, and you can ask your questions there and get more information. Back to you, Steve.
I endorse that idea. Thanks to Lydia and our wonderful speakers. That was a great conversation. Thanks again to our sponsors and partners, Quantum Health, Aaptiv, and Kintone, and to all of you who participated today. If you'd like to join us for more virtual events, you can head to our website, fromday1.co, and check out more of our upcoming webinars and virtual conferences. Just a few of them coming up. This Thursday, July 16th, the future of apprenticeships in a remote learning era. On Wednesday, July 22nd, the new push for workplace equity, which is a part of a virtual conference from 1 to 5 Eastern Time. And on Thursday, July 23rd, employee recognition, why it's more important than ever. So thanks everyone, be well. Till next webinar.